Go ahead.
Ready? Hello, Mrs. Doe.
Hi.
Hi, my name is Daniel Butcher. I'm a PA student from University of Cumberland. Let me wash my hands real quick and we'll go ahead and we'll get rolling. Okay, real quick, let me get some patient identifiers. Do you mind telling me your full name
Jane Doe,
and date of birth?
6694.
And then make sure your record number matches up here with mine. Yep, everything looks good. Okay, so today we're here to do a breast exam, a pelvic exam, and a pap smear. Does that sound right?
Yes.
Alright, so let's go ahead and get started then. So first thing we would do is we're going to start with the breast exam. So we're going to start with inspection first. So I would have the patient be disrobed down to the waist, and I would have the patient be sitting upright. So when we inspect the breast, we're going to be noting the contour, the symmetry, look for masses, dimpling rashes, and nipple discharge of each breast. And then also when we do this, usually the patient will have one arm behind the head or vice versa. There's many different positions to inspect the breast, so that's good there. Okay, so now we're going to move on to actual palpation of each breast. So we're going to only expose one breast at a time, and we're going to have the patient be laying supine to do this. Okay. So I'm going to be going and palpating in small concentric circles, applying light, medium, and then deep pressure using the pads in my second, third, and fourth fingers. So we're going to begin up here in the axilla, checking for enlarged lymph nodes up there, and we're going to palpate straight down to the bra line, okay? And we're going to keep moving medially up the chest, okay? And then once we get up here to the clavicle, I would then check the supraclavicular lymph nodes and infraclavicular lymph nodes, okay? Now we're going to continue to move back down the breast, and I'm going to keep moving medially in an overlapping vertical pattern. Okay, and then just a little more. And once we get to the mid-sternum, that would complete the exam on the right breast. And then we're going to move back to the same breast we were just palpating, and we're going to palpate the nipple to note any elasticity or any discharge if present. And then we would just repeat that same process to the opposite breast. Okay, so then that would conclude the breast exam. So now we're going to move on to the pap smear and the pelvic exam. Okay. So first of all, for the pelvic exam, we're going to have to position the patient correctly. So first, I would tell the patient to empty their bladder if they needed to, and then once they came back, then I'm going to place them in the lithotomy position. So buttocks at the edge of the table, the thighs flexed, abducted, and externally rotated at the hips, and I'm going to have them be laying supine with head and shoulders rested on the pillow with arms down at the side. And then once I'm going to have them draped from the abdomen or mid-abdomen to the knees, and then I would just depress this drape right here so I can maintain eye contact with the patient. Okay, grab some, oh thank you assistant. Got some gloves now, ready to roll, okay. Okay, so now we're going to begin first with the external exam. So I'm going to warn the patient that I will be touching your genitals, and so now I'm going to go ahead and begin the external exam. I'm going to be seated for this, and so we're going to begin with inspecting the labia, the perineum, and the perineum, and there's one more word, we're going to go back to it, okay? So then we're going to separate the labia, and then we would go ahead and inspect the introitus, the urethral meatus, and the clitoris. Okay, everything looks good in there. Okay, so now we're going to go ahead and begin the exam with the speculum. Okay, so we're going to make sure that we choose the appropriate size speculum and make sure we moisten it with warm water. And then now I'm going to have to warn the patient I'm going to be inserting the speculum. So go ahead. And now I'm going to go ahead and place my finger in the introitus first and apply downward pressure just to enlarge the opening to make insertion of the speculum a little bit easier. Okay. So now I have downward pressure applied, and then I'm going to go ahead and insert the speculum at a downward angle just past the fingers. Okay, and also the word just kind of came back to me, Mr. Reed, that the other word that I left out was the mons pubis. So there you go. Okay. So anyways, now we're inserting the speculum at a downward angle just past the fingers. Okay. And while I'm separating the labia with the other hand, which is kind of hard to do with this. So, okay, so now I'm going to continue to insert the speculum along the posterior wall, applying a downward pressure again with my finger in the introitus to relax the introitus opening. Now once the speculum is inserted, I'm going to go ahead and remove this finger, And then I'm going to go ahead and continue to insert the speculum and rotate it to a horizontal position, okay, by applying posterior pressure. I'm going to make sure that's inserted to full length. And I'm going to open the speculum now cautiously, but not prematurely, okay? Okay, so now we're just going to look in here and try to observe the cervix, and speculum should be able to cup the cervix, and this should have a light source on it, and we would adjust the light source if needed, and the slope of the speculum as well, but I can see the cervix just fine even without it. So now we're going to go ahead and lock the speculum into place. Okay. And now we're ready to do the pap smear. Okay. So now we go ahead and grab the cervical broom and insert it through the speculum into the cervical os. And we're going to go ahead and collect a sample of squamous and columnar epithelial cells by sweeping in a clockwise direction. Okay, so now that that's done, we're going to go ahead and just place the sample directly into the preservative so that can be sent off to the lab. Alright, so now we're done using the speculum and the pap smear, so now I'm just going to go ahead and unlock the speculum. But I'm going to keep my thumb on it to keep it opened up because we don't want to pinch down on the cervix or anything. So I'm going to withdraw the speculum slowly. Again, the same motion as I inserted it by exiting horizontally. And as we're pulling it out, I'm going to make sure that it clears the cervix first. I'm going to withdraw the speculum slowly here. And while we're withdrawing the speculum, I'm going to be observing the vaginal walls. Okay? And then make sure that whenever that we withdraw the speculum, that it's closed, because we want to avoid stretching or pinching any mucosa. So when we're inspecting the vaginal walls, we're going to be looking for color, inflammation, discharge, ulcerations, or masses if present. Okay? So that's going to conclude our exam with the speculum. So now we're going to move on to the bimanual exam. So for this, I'm going to be actually in standing position. Go ahead and get here. Can I get a better view? Okay, so I'm going to go ahead and apply some lubrication here to my right hand. I'm going to be inserting a lubricated and gloved index and middle finger into the vagina. And I'm going to flex my little and ring finger into my palm with my thumb abducted. These models are kind of tight, so I'm actually just going to use my middle finger here because it's hard for me to insert. Okay, so I would again warn the patient that I'm going to insert my fingers to the vagina. Okay, so now I'm going to feel the cervix first. So when we feel the cervix, we're going to be trying to note shape and position and mobility and tenderness of the cervix. Okay, so now we're going to palpate each fornice on the lateral aspect of the cervix, and if you have pain, or normally you should be able to move the cervix without any tenderness, or at least move a little bit without tenderness. And again, we're palpating the fornices now, and if you have pain when palpating the fornices along with tenderness of adnexal structures, this could indicate pelvic inflammatory disease. Okay, so now we're going to move on and try to palpate the uterus. So I'm going to take my other hand now, and I'm going to press down in the abdomen midway between the pubic symphysis and the umbilicus. Okay. And I'm going to actually try to elevate the cervix and the uterus with my pelvic hand. I'm going to try to just grasp that uterus in between these two hands here. Okay, that's good. So now we're going to move on and try to palpate each ovary. So we're going to do the right ovary first. So I'm going to place my pelvic hand on the right fornice. I'm going to place my abdominal hand down here in the right lower quadrant. I'm just going to press down and in with this abdominal hand here to try to press the right ovary and any adjacent adnexal structures towards my pelvic hand. And note the ovaries are normally tender, and if you feel any adnexal masses, it could be due to tubo-ovarian abscess, salpingitis, or ectopic pregnancy. And then once we're done with that, we would then repeat the same thing, trying to fill the left ovary and adnexal structures as well. Okay, so I'm going to go ahead and withdraw my fingers now, and then we would change gloves and re-lubricate the fingers for the rectovaginal exam, or vaginal rectal exam. But in this case, just for time's sake, I'm just going to keep the same gloves on. Okay, so now again, we're going to warn the patient that I'm going to be inserting my fingers into the vagina and the rectum. So first thing, I'm going to insert my index finger into the vagina and middle finger into the rectum, and I'll just have the patient bear down, and that's just going to help relax the sphincter here, or the anal sphincter. So I'm going to apply pressure to the anterior and lateral walls while I'm pressing downward and applying pressure with the abdominal hand. Okay. And now I'm going to withdraw my fingers, and I'm going to insert my index finger. Again, I would change gloves for this and re-lubricate. I'm going to insert my index finger into the rectal vault and just sweep the rectal vault, try to feel for any masses if present. Okay, that's done. So now we're done with the exam. Now I would offer the patient a tissue, rag, or towel, whatever we had, so she can clean her genitals and anus of all the lubricant. And that actually concludes our exam, Mrs. Doe. Do you have any questions for me? Okay, thank you. I'll report my findings to my preceptor and we'll be back with you shortly. Thank you very much.